Good morning, good afternoon, or good evening, whichever it may be for you. I am Kenzo Sanga, and this is my teaching project on home remote monitoring and congestive heart failure. I am a home health admissions coordinator nurse at St. Jude's Medical Center in Southern California. I am part of a pilot program within my health system implementing a home remote monitoring service for congestive heart failure patients being discharged from the hospital. So today, I'm going to show you how we as nurses and nurse educators can care for our CHF patients better while preventing rehospitalizations and saving money. These are the objectives of today's presentation. By the end of this 15-minute PowerPoint, you should be able to identify significant burdens of CHF on healthcare, define home remote monitoring, and be able to describe the interventions that home remote monitoring provides. As nurses, you probably know that CHF patients tend to come in and out of hospitals a lot. But did you know research shows that CHF patients are admitted to the hospital an average of 3 times per year? And 50% of patients die within 5 years of the initial diagnosis. Let's do a quick review on congestive heart failure. So, what is congestive heart failure, or CHF? I want to know from you guys. Is it A, an abnormal blood flow between 2 major arteries in the heart which remain open after birth instead of closing like it should? B, when the heart loses its ability to contract normally, resulting in a lack of force to push enough blood into circulation? Or C, when the heart's 2 upper chambers beat chaotically and irregularly, causing poor blood flow? Why don't you take a moment to refresh your memory and select the correct answer? I'll wait. Time's up! Okay, the answer is B, when the heart loses its ability to contract normally, resulting in a lack of force to push enough blood into circulation. So give yourself a pat on the back if you got that right. Here is a short 2-minute video overviewing congestive heart failure, the pathophysiology, the causes, signs and symptoms, and some treatment options.
Congestive heart failure occurs when the heart fails to pump an adequate amount of blood to meet the body's needs. Fluid accumulates in the heart, the vascular system, and the lungs. In the lungs, this causes pulmonary edema. With each beat of the heart, about 60 to 80 milliliters of blood is ejected to meet the body's needs. In congestive heart failure, the heart muscle begins to lose its ability to pump efficiently, and not enough blood is ejected with each beat. The lack of oxygenated blood will cause dyspnea, tachycardia, and tachypnea. This is the body's attempt to compensate for the decrease in blood flow. The heart cannot take in more blood. The fluid then begins to back up in the venous system, leading to neck vein distension and edema of the feet and lower legs. In congestive heart failure, only one side of the heart may be affected. In right-sided failure, there will be further congestion in the liver and the spleen, causing abdominal edema. In left-sided failure, fluid backs up into the lungs, causing pulmonary edema, a life-threatening emergency. In addition to severe dyspnea, there may also be blood-tinged sputum. Congestive failure leads to an enlarged heart, distended neck veins, liver and spleen congestion, abdominal edema, lower leg and ankle edema, and pulmonary edema. Treatment is aimed at reducing the fluid congestion by the use of diuretics, restriction of fluid, and salt intake. Cardiotonic drugs are also used to slow and strengthen the heart.
So how can we manage CHF? Aside from medications, patients can check their weight daily, they can alter their diet and reduce their sodium intake, they can increase their activity and exercise, they can learn how to cope with stress, and also they have to have consistent follow-ups with their healthcare providers. So why is CHF such a big deal? Why is this important? According to the American Heart Association, congestive heart failure affects nearly 4.8 million people nationwide. They are hospitalized 3 times per year on average. It is the #1 cause of readmission within 60 days of discharge. 50% of patients die within 5 years. And finally, in 2007, the costs related CHF was estimated to be 30 billion with a B in the United States. Now that we see the effects of CHF and the burden it has on healthcare, how does CHF affect our patients? Which is really the most important question. This is a CHF case study or scenario, just so we can visualize what really happens on a regular basis to our CHF patients in the United States. So follow along with me. This is Bill. Bill is a 7-year-old male with chronic hypertension and diabetes. Bill also has CHF. Bill was diagnosed with congestive heart failure 3 years ago and was recently admitted for the second time this year due to acute exacerbation of his CHF. Prior to discharge, Bill was given a lot of instructions on his medications, on his diet, how to monitor his disease, and who to call for a follow-up appointment. Bill was very overwhelmed and very confused, but he got discharged anyway. This is Bill's home. Bill is very independent and he lives alone, but he can be forgetful at times and forgets to take his medication. Bill also has a very poor diet. He likes to eat deli meats, canned foods, and frozen TV dinners. In 1 week, Bill had gained 10 pounds after he got discharged. His feet were so swollen he could not fit into his shoes. He had frequent dry hacking coughs, dizziness, trouble sleeping, and loss of appetite. He was so short of breath that he finally had to call 911. Upon arrival at the hospital, Bill was confused and coughing up pink, frothy sputum. He had bilateral crackles throughout the lungs, 3+ pitting bilateral lower extremity edema. He had a heart rate of 100, blood pressure of 160/82, a temp of 98.6, respirations of 26, and an O2 sat of 84 in room air. Sadly, Bill later experienced a cardiac arrest and died at the hospital. Now, how could we have avoided this? Ponder upon this case study for a moment and give me your thoughts in the comments. Bill was given the usual care. Usual care involves discharge instructions plus a follow-up appointment with a PCP or specialist. With that being said, this is where remote monitoring could have made a difference. Home remote monitoring, remote patient monitoring, telemonitoring, home telehealth, telemedicine, mobile phone-based monitoring, these are all synonymous to what we know as remote monitoring. Remote monitoring is defined as technology that enables monitoring of patients outside a clinical setting. It is a promising strategy that enables clinicians to intervene early when there is evidence of clinical deterioration. So, how does home remote monitoring help? Many patients with heart failure deteriorate within weeks or even days. Daily monitoring alerts clinicians of early signs of exacerbation, which can potentially prevent a hospitalization. And again, reducing hospital admissions reduces costs to insurers, patients, and potentially non-reimbursable events for hospitals or facilities. This is a helpful diagram explaining how remote monitoring basically works. Feel free to pause this video and zoom in on this image to examine some more. So, what type of interventions or unique services does the home remote monitoring program provide? First, they take daily vitals. Patients have to take their weight daily, their blood pressure, their heart rate, their oxygen saturation, and sometimes even an ECG will be set up. The program will actually provide equipment for the patient, and the patient just has to enter these results into a tiny little computer device. Second, that device can also take questionnaires. For example, have you felt more short of breath in the last day? Or have you felt any lightheadedness or dizziness in the last day? These types of questions can help the nurse on the other end or the physician on the other end to get a better picture of what's going on physically with the patient. Also, biometric parameters can be set up. So if a patient enters in a heart rate that is greater than 100, it will automatically alert the doctor or the nurse about this patient's status. A great service also is a nurse call center. So not only are nurses monitoring these servers, but patients can call the call center and ask any follow-up questions, and vice versa. The nurse can call the patient if something is out of whack with their vitals or something was a little bit off with their answers. And the most important intervention is probably the rapid intervention. Most home remote monitoring programs provide same-day intervention. That is, if the patient submits their questionnaires and their vitals on time, and if something is wrong, a nurse can call the patient. A nurse can even set up a home health visit to send a nurse there, and then medications can be adjusted, and worst case scenario, 911 can even be called for the patient. Well, Kenzo, what does the research say about home remote monitoring, you might ask? Well, research supports home remote monitoring. This article, one of the two that I did a review on, titled Comparative Effectiveness of Different Forms of Telemedicine for Individuals with Heart Failure, a Systematic Review and Network Meta-Analysis, concludes that telemonitoring with structured telephone support interventions were found to be significantly better than usual care in reducing deaths and heart failure-related hospitalizations. And I quote directly from the article, "Available interventions were ranked according to their effectiveness in reducing the outcomes of death, hospitalization due to heart failure. When these different interventions were ranked, telemonitoring was always ranked first." This is the second article, which also supports remote monitoring. It's titled Home Telemonitoring for Congestive Heart Failure, a Systematic Review and Meta-Analysis. 21 studies provided evidence suggesting home telemonitoring provides better clinical outcomes for patients with CHF compared to usual care. It concluded the remote monitoring reduced the mortality rate and number of hospitalizations. And again, I quote, "Home telemonitoring is not intended to replace health professional care or visits, but rather to enhance the level of care." These are just small examples of studies, randomized control trials, meta-analysis, systematic reviews that support the effectiveness of remote monitoring. So, in conclusion, I hope you, as a future nurse educator, learned about remote monitoring from this presentation. You learned and now can identify statistics as to why CHF is a burden to healthcare. You learned what exactly home remote monitoring is. You learned specific interventions that improve care for CHF patients through home remote monitoring. And finally, you learned how current evidence-based research supports home remote monitoring because it enhances care, prevents rehospitalization, and reduces outcomes of death. In closing, I want you to take away 4 points from this presentation. Home remote monitoring provides better quality care compared to usual discharge care. Home remote monitoring significantly reduces the risk of death. Home remote monitoring significantly reduces rehospitalization. And home remote monitoring reduces costs to insurers, patients, potentially non-reimbursable events for hospitals and facilities. I thank you very much for listening to my presentation. If you have any questions, please comment on the Blackboard thread and I will respond to you. And I hope you have a good day. Thank you so much.